Welcome to the NC Spin After Spin. Additional comments from our panelists just available on our website. Peg O'Connell, what do you wish you had said on last week's show, but you didn't?
You know, Tom, at the end, I talked about the number of kids going into foster care because their parents are struggling with substance abuse disorder. I think the follow-on to that is, and you all know I've been working on the issue of closing the coverage gap for the last several years. If we were able to close the coverage gap in North Carolina, provide some sort of health insurance, affordable health insurance option for the working poor in the state, a lot of those parents who struggle with substance abuse disorder, lose their kids, would be able to get treatment and get those kids back and get them out of the foster care system.
This was the Care for Carolina program that you talked about.
Right, and Care for Carolina is the coalition. Carolina Cares was a bill that was put in. And we'll see, I think, a number of legislative attempts to try to close this coverage gap in the coming session.
This opioid crisis is particularly acute in our state, and we talked to the governor about that. We've got a segment of the interview we did with him about that. He's very concerned about this also.
Well, and you know, the opioid crisis, and 90% of the people who come to the emergency room with an opioid or some sort of drug overdose are uninsured. So, I mean, not only, you know, we talked about what's going on in the healthcare system, not only are these people not able to get treatment, but they can't pay for the services they get when they show up in the emergency room.
And that naloxone, as I understand it, ain't cheap.
No.
Well, thanks for watching the After Spin. We'll have more video all during the week on ncspin.com.